Varicose vein. Varicose veins are defined as dilated, elongated, tortuous, and palpable superficial veins as a result of venous hypertension. Presentation: more commonly seen in males in India. Lower left limb are more commonly involved. Long saphenous system is affected in 2/3 of cases. Venous system of the lower limb consists of deep system of veins lies below the deep fascia, superficial system of the veins which lies outside the deep fascia, that is above the deep fascia, and perforating veins which passes through the deep fascia joining the superficial and deep system of veins. Valves in the veins. Valves are present in the superficial veins. It prevents the flow of blood from the proximal to the distal and from the deep to the superficial. Absence from above in the at the above groin level, that is valves will be present in the lower limb. Valves can resist pressure up to 300 mm of Hg. Factors helping in venous return: negative pressure in thorax during the inspiration, that is -6 mm, cough muscle pump, that is soleus muscle. Normal venous pressure is in relaxed state is 20 mm of Hg, raised up to 80 to 100 mg of Hg during muscle contraction. Visit ergo: arterial pressure transmitted to venous side through capillary bed. Competent valves. Venae communicants lies inside of artery, helped by arterial pulsation to propel blood. Types: primary and secondary. Primary idiopathic, more common in women. In lower extremities, strong family history. Secondary due to DVT, deep vein thrombosis, and other infectable obstructions. Also occurs in esophagus, hemorrhages, and arteriovenous malformation. Etiology, that is causes for varicose vein: long hair standing which increases the hydrostatic pressure or of gravity. Family history: pregnancy, aging, deep vein thrombosis, using of oral contraceptives, and obese people. Pathophysiology behind varicose vein. Etiological factors will cause enlargement of veins. Valves are stretched and become incompetent. Backflow of the venous blood, further increased distension of veins, and clinical manifestations will be cosmetically disfigurement will be there, dull aches, muscle cramps, increased muscle fatigue in the lower limbs because of lack of blood supply, proper blood supply, ankle edema and feeling of heaviness of legs, nocturnal cramps, nighttime pain. Diagnosis: history collection, physical examination, duplex ultrasonography, venography, both ascending and descending. Complications of varicose vein: bleeding, thrombophlebitis, venous hypertension leading to venous ulcer, calcification, eczematic dermatitis, and pigmentation. Conservative management: avoiding prolonged standing, because prolonged standing is a reason for varicose vein, so you need to avoid prolonged standing. Avoid prolonged standing, creep bandaging and elastic socketing from the toe to the thigh, which causes decreased edema, venous volume, and reflux and increases venous return. Limb elevation above the level of the heart while lying down. These are the conservative methods to prevent varicose vein. Sclerotherapy: a chemical is injected into the vein, irritating the venous endothelium and produce localized phlebitis and fibrosis, thereby obliterating the lumen of the vein under ultrasound guidance. Hypertonic sodium chloride solution: sodium morphoate, ethanol amine oleate, Polydocanol. Spread of foam monitored under USG guidance as it spreads. Apex of the saphenous opening compressed by probe to prevent foam entering deep vein. Legs also elevated after leg is wrapped with elastic bandage for 24 to 72 hours. Surgical management, high-end ligation and stripping. Ligation of entire vein and dissection and removal of its tributaries. Endovenous laser ablation EVLA, US guidance LSV cannulated above knee joint, guide wire passed beyond superficial superior femoral joint, tip is placed 1 cm distal to superior femoral joint, laser fiber inserted up to catheter, diode laser used for firing. Laser fiber produces endoluminal heat that destroys the vascular endothelium. Nursing management, bed rest is maintained for 24 hours, after which the patient begins walking every 2 hours for 5 to 10 minutes. Elastic compressions stocking are used to maintain compression of the leg. They are worn continuously for about 1 week after vein stripping. The foot of the bed should be elevated, standing still or sitting are discouraged. Usually the patient may shower after first 24 hours. The patient is instructed to dry the incisions well with a clean towel using a patting technique rather than rubbing. If the patients underwent sclerotherapy, a burning sensation is the injected leg may be experienced for 1 to 2 days. A nurse may encourage the use of the mild analgesic like acetaminophen and ibuprofen. This is all about the varicose vein. You learned the treatment, management, presentation, diagnosis, etiology, pathology, types, factors causing varicose vein, definition, everything. If you find this video helpful, please do like, share and subscribe to my channel, and if you have any suggestions, let me know in the comment section. Thank you.